Good afternoon, and welcome back to HealthLeaders The Winning Edge program, a series of webinars touching on the topics and strategies that you need to know most. My name is Luke Gale. I'm the Revenue Cycle Editor for HealthLeaders and will serve as your moderator for this session. Today's webinar is titled The Winning Edge for Technology Investment. Thank you to you and our audience for participating. Before we get started, for those of you participating in the live program, I have a few housekeeping details. Note that an on-demand version of this program will be available on our YouTube channel on Friday and can be accessed through our website, healthleadersmedia.com. To ensure that you can see all the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. Next, you will find a resources list for today's webinar on the upper right of your screen. Here we have listed the webinar slide deck and some additional materials for you to download, along with a registration link for future The Winning Edge events. At the bottom of your console are multiple widgets you can use. To submit a question, click on the Q&A widget. It may be open already and appear on the left side of your screen. You may submit questions at any time during the presentation. However, please note that it is unlikely your questions will not be answered until the Q&A portion of the program. Finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. At this time, it is my pleasure to introduce our panelists for today's discussion. Janine Mages, Vice President, Clinical Revenue Cycle at Kaleida Health, and Christina Slump, System Vice President of Revenue Cycle Financial Services at UNC Health. Thank you both for joining us today. And with that, let's get into our discussion. And first, why don't we start with you, Christina? Can you tell us a little bit about yourself and your organization?
Sure. I'm Christina Slump. I'm with UNC Health. We are located in Chapel Hill and throughout North Carolina. And I've been doing RevCycle for about 15 years and leadership and data analysis for about 30 years. So glad to be here today.
Thanks, Christina. And Janine.
Hi, good afternoon, everyone. Janine Mages here. I have been in the revenue cycle for about 12 years at this point. Our facilities that we oversee here in the Western New York area, go Bills. We have 7 hospitals, a cancer care of Western New York, Visiting Nursing Association Center, as well as UBMD, which is our Buffalo physician group that go to school there. We have residents for a teaching facility, as well as ECMC and some physician practices. Thanks, Luke.
Thank you, Janine. Moving on to our first question. When evaluating revenue cycle operations, how do you identify specific pain points that are prime candidates for a technology solution rather than a process change? And Janine, you want to start?
Sure. So that's a really good question. One of the things that I like to do when we're identifying pain points is looking at our KPIs and our metrics, really seeing if there's any trends or difference year over year, month over month, or even week over week, depending on what's going on. I think a lot of what drives that is the goal of the organization. I'm sure many folks also have this where your organization focuses on specific goals for each year. So example for us, we're focusing on length of stay and how we can support that throughout the facilities. Additionally, what else I like to do is round with the team. Of course, my directors will escalate anything to me, but I also think it's super important to be meeting with the staff that is doing the work to get their process, understand what they have identified because they're the ones that are working it day to day. And really identify there to understand what that solution for change would be with them. Christina, what are your thoughts?
Yeah, similar to you, Janine, I think we're looking for things that take away manual touches, things that are impacting. It's kind of concurrent, right? What are we touching manual that takes a lot of our time that we get very little value out of, so that if we can automate it, use technology for it, that makes things easier for us. And definitely from the KPI standpoint, looking at things that are affecting our cost to collect, our days in AR, our denials, our cash that ultimately are going to keep our healthcare system afloat. So we start there. Sometimes, you may concurrently be working on low-hanging fruit, things that you can quickly get out of the way, but then you have your bigger picture where things take more time to implement with technology, but there's a bigger bang at the end of it. So I think you have to do that full cycle review and continually looking at those things.
And I think, Christina, you hit, oh, I'm sorry, Luke. Christina, I was going to say, I think you hit something spot on there with taking a look at the denials. A lot of what you see from a denials aspect, whether it be administrative or clinical, is really telling you what the payers and everything that they're seeing from the outside perspective and how you can do your best practice move forward. So for an example with that would be, if we believe that one patient should be an inpatient level of care or an observation level of care, really root cause and why we think one way and the payer might think another way, and trying to have those like conversations.
Yeah, absolutely.
Thank you both. Moving on to the next question. What are the key components of an effective business case that you present to leadership? How do you estimate ROI, not just in hard dollars, but also in soft benefits like improved staff satisfaction or better patient experiences? Christina, would you like to start?
Sure, absolutely. I think a good component that you want to present in a business model is going to include really what's your baseline, what are you trying to prove, where are we going, where am I taking everyone on this journey with me, and of course the cost, timelines, your ROI, risk, KPIs to get there. But to your point on soft, things we also need to take into account that patient satisfaction. What change management are we doing in this project that I'm proposing that's going to impact our patient, our staffing, our employees? And sometimes value doesn't always come from just a cost saving. Sometimes the value comes from giving a clinician more time to breathe, right? More time to interact with the patient, giving an associate more time to feel impactful and not continually on the hamster and the hamster wheel, for lack of a better thing. What are your thoughts, Janine?
Yeah, I agree with you on that. And I think some of it is ultimately can be difficult to come up with the ROI to it, especially when you're talking about the soft solutions, such as the clinician or even staff satisfaction. So when you think about, as you had mentioned, with the physicians not only having to document and meet with the patients and point click and click in the EMR to see what happened in the last visit. One of the solutions that I think would be really helpful for our physicians is an AI solution where they can just walk into the room and have the conversation as we're having. May not ultimately see the ROI back on that, but that would be a huge clinician satisfier. As well as the patient experiences. I think from that aspect, you also need to take in your facilities clientele that come in, right? So, some of our facilities here in Western New York are urban facilities and not the most high-tech individuals that come in. So if we're using, an electronic check-in, we know here that we're going to want to also have somebody else there to help guide them. Or at one of our other facilities, having that electronic check-in for like an ambulatory surgical center might be a little bit easier for that clientele coming in. Again, that is one of the things that I believe you have to weigh in there when you're looking at the soft solutions is understanding your patient mix. And same thing that you had mentioned, Christina, right? When you talk about estimating the ROI, it's not only in the metrics where we're going, where we came from, our targeted baseline and how we're measuring it against that targeted baseline. But I also look at it, what is the benefit that this has to the organization? So if I'm going to be implementing, say that AI solution for clinicians, how is that going to help not only my clients, my patients, and my physicians, but how is that going to help the overall business? Are my physicians going to be able to see patients quicker, round faster on them, et cetera? So I think that that's everything that needs to go into this when you think about it. Anything to add, Christina? I feel like this one can kind of get... I feel like you can go off on a deep end on this one a little bit, if I'm being honest.
I think you should.
Well, because I think when we're working in the healthcare industry that we are now, I'm sure, most are up to date and on this call with, ever-changing payer policies, ever-changing Congress bills that are coming out. A lot of what we're seeing and experiencing within our Western New York area is how can we make sure we're financially stable? So a lot of what we do when we present forward does come up with an ROI estimate or needs to have that ROI estimate associated with it in order for us to be able to implement it. It's the nature of the beast of where we're at this point. And then again, when you think about the staff satisfaction, one of the things when I think about with that is if I'm going to upgrade a software or implement software, I always want the staff buy-in and I want them to trial and pilot it to make sure that it's effective. I get that in a perfect world, we would be able to do that for everything. And sometimes there's just decisions and software we need to implement. But that also helps, I think, improve some of the staff satisfaction.
No, I agree with that, Janine. I think communication is key, right? Not just us giving the information to them, but also opening up that communication two-way so that they can give us the feedback. Whether, like, we don't always have time, like you said, to allow them to completely work in that, but making sure that they feel heard. I think at the end of the day, it's just like a patient, right? Patient or people just want to be heard. And I think making sure that you have that communication in place to measure that ROI. Because when you talk about the turnover, that's not really a soft turnover, right? That's a cost to us as an organization. And the better that we can support our team members in that, that's going to really come back to us, fourfold, if not more. But I think that's a hard one to measure because it takes a while to get there to see what that impact is, in the turnover and the satisfaction. But going back to your original thought that made me think was communication and making sure that communication flow is set up to go bi-directional.
Well, you hit the key point on the turnover, right? So, I think that we're all experiencing this, or at least we are in the Western New York area, of if you're one of the teams that reports up to me as a clinical documentation specialist, typically they don't come trained, and it takes us 2 years to get them up and training. And one of the things that we find is we get them up and trained, and with other facilities allowing more and more remote work, we have higher turnover rate, which to your point, Christina, the cost that is associated with that when we have to continuously train everybody, what can we do to improve the satisfaction here, especially if we're looking at software solutions, to make sure that they're happy and they'll stay here with it and it's not just another step up for the next position or something else.
Yeah, absolutely.
So I do want to ask, you mentioned, Janine, and I think you probably agree with this, Christina, that it's important for you to provide staff with an opportunity to demo new software or new technologies. So when I'd imagine it's more difficult, I'm really not sure, but when you're introducing a new patient-facing technology, are there opportunities to sort of pilot those with the patients and to see if those work? Can you tell me a little bit about that?
Yeah, so we're in the midst of an Epic implementation here at Kaleida Health, and so we're starting to look at a lot of that software solution. At this point, what we are currently doing with some of the patient-facing software, as you mentioned, is really reaching out to facilities that are using this to understand what are the impacts that you have seen, where are the benefits, where are the negatives, where are some of the things that we should have been prepared for. I think from there, we're still assessing if we're going to invest and pilot it in a couple of our facilities to see how it turns around. But at this point, that is where we're at. We like to use the term super user. And so anytime that we have, somebody who, if we're going to be implementing the new software, we take a select super user group that volunteer to be a part of this implementation and give us their feedback and their recommendations. So I will say at this point, I don't believe we have any opportunity to look and doing some of that patient trial, but maybe down the road. Christina, have you experienced anything like that?
No, I think it's harder when you think of patient facing, and trialing that piece of it. I think to your point is we have great relationships with other healthcare centers here in the Triangle where we have monthly calls. And so if we're going to implement something or try something, we will reach out to them. And then obviously connections that we have through our leaderships and stuff throughout the United States, the two other health systems that have done that. To make for sure that we understand the impacts. How do we want to drive this, to Janine's point?
I'd imagine too, there's probably a little bit of a learning curve, and you talked about this, Janine, how in some centers you do need that kind of human backup to the patient-facing technology, which seems like it could be a challenge. And is there, I guess, are there strategies that you kind of use to help patients overcome that learning curve, or to make that sort of that period go by more quickly?
Yeah, so we always have the love-in tips to help everybody, or the QR codes that they can use. But a lot of the times we'll put like our personal business office phone number on there so that you can call one of us to say, hey, I got stuck here, I need some help with this. And as mentioned, we always have a couple people on site to help assist as needed. I can even just speak for myself. Walking through the hospital here, if I'm leaving today and I go down on the first floor, I can guarantee there's going to be a patient that needs help or needs directions. For us, it's typically they want to go to Tim Hortons. And so, I just think that when you're looking to implement anything like that, that you need to have that additional support, because at the end of the day, our job is to take care of that patient. They are our number one priority.
Awesome. Anything to add, Christina?
No, I think she said it perfectly. I don't think I could do any better or add anything additional.
Great answers. Thank you. Moving on, and you both addressed this a little bit, talked about how you kind of touch base with staff before introducing new technologies. But this is new technology often fails because of people. So how do you not only prepare and achieve buy-in from frontline staff and clinicians for new technologies, but empower them to become champions of new technology? Christina, would you like to start?
Sure. I think just echoing what we had in our earlier conversation, but one of the things, I think Janine called it a super user. I think some organizations call it a SME. I think that is so important no matter how you utilize it. I think peer-led sessions, I can come in and lead a session all day long, but if it's a peer, that somebody that's been through it, that knows it, I think there's some respect there and there's some openness there, right? Where they may not tell me what their issues are and how they feel, but if it's a peer or somebody that they feel like on their level, that's going to open that communication better. Back to my original thoughts on communication and making for sure that they have that two-way bidirectional, and just making for sure that the messaging is relatable, right? I think sometimes as executives, we're so used to talking at a high level that we have to make for sure that when we are talking to staff that may not be at that level, that may not be used to hearing that we make it relatable, right? Because we understand it because we've probably been working on it for months. But when we are giving that input to them, we have to make for sure that it's relatable. Because if we're just talking, it can just be words. So I think that's the most important thing, is to make for sure that it's relatable, using peers, and making for sure that there's a flow back to us. And that we do something with it, because it's not just that they have a way to give us feedback, but what do we do with it so that they feel like that when they are saying something and giving feedback that we're evaluating and doing something with that.
Great. Janine?
Yeah, I agree with everything Christina said. I'll just, add on to it a little bit to the feedback. I think that's important. And that's one of the things that for myself, especially as we implement, and we have implemented so much new software within the past year, it is important. It's crucial for me that my leaders are meeting with the team within their individual monthly meetings, highlighting, hey, these are the glitches, these are the errors that we're seeing, these are our next steps, these are our follow-through items, as well as for the super user or the SME, making sure that they are meeting with them weekly so that they can escalate, hey, this doesn't seem to be working appropriately in the software. I will say, from my experience from the most recent implementation that I had, when the technology failed, so to speak, it wasn't necessarily failing from the people aspect of that. We had a lot of buy-in from the staff. I think from our end, some of what we saw, though, is more seasoned individuals, a little bit more reluctant to the change. Change is always scary, but as all of us know, when we work in healthcare, change is inevitable. I'm pretty sure that there are regulations that just changed overnight that we'll find all about tomorrow. But, that is one of the things that we need to really, at that point, monitor their productivity, monitor their usage of the tool, and start having some of those one-on-one conversations, especially if the rest of the team has gotten on the bus with it. So yeah, I think Christina said it very well with your, and we always solicit for champions. It's always our goal to say, wow, this is a software that we are implementing. We want you to be a part of it. We will also get to the point to what Christina had said is, when you make sure that you want to talk to the staff level language to language, we will actually have one of our super users partner with a manager on the team to make sure that the workflows that we have documented and the policies that we have written make sense and correlate back to the teams as needed.
Wonderful. Thank you both. Before we move on, Christina, anything to add to that? Any response? Great.
No.
So once a new technology is live, how do you track its performance against the initial business case? And I think you did address this, in that second question about, identifying specific pain points, and in the third question, building business cases. But anything to add to that? What KPIs are you using to track the success of a new technology? Especially, I guess, when it comes to those soft benefits. Christina?
Sorry.
No, go ahead, Janine. Janine started, so we'll let her.
Thanks, Christina. It's always weird sometimes, though. What I say what we'll do is when we go live with a new technology, as I mentioned earlier, unfortunately or fortunately, we're in the state where we are, at least within our facilities in Western New York, where finances are being scrutinized. We want to make sure that we constantly have enough money and cash on hand for the upcoming days, for everything we have going on. So one of the things that we do to track our technology is from the ROI aspect. So, I'm going to use my clinical documentation specialist team as an example. We do track them from a financial impact. And so when we track that, we're tracking it against the baseline prior to the implementation, and then the months after that implementation to understand, were they able to make some system impacts with some of these AI solutions we have implemented? Do we have a dip? The caveat there is you always want to make sure that you're also comparing that against your CMI and your patients population that is coming in, because, some months here, at least in Buffalo, some months here we get a little cold and people get a little sick, and we have a lot of RSV coming into our children's hospital, where in the summer months we typically will see more elective surgeries because people are off for the summer. So that ebb and flow is inevitable. We also, from that aspect, will track, thankfully, as technology has evolved, it's evolved to allow us to track to understand how the team is utilizing the new software. So one of the things we implemented was clinical evidence sheets, and ultimately these are the low-hanging fruit for the CDI team to help say, hey, Janine, you missed a query opportunity here. Look at these clinical indicators. On the management side, we're able to pull that and say, how many times was Janine nudged to say, hey, you missed this opportunity, so that we can identify, one, does she need education in the specific diagnosis? Two, is she ignoring the nudge? Or three, is there an issue with the software that maybe it's not identifying the right clinical information? So that is a lot of what we'll use on our end, and we'll track it on individual metrics. And again, productivity is super crucial. I think a lot of the time when you're looking at this new technology, you're looking for how can we become more efficient, because we always try to do more with less. And so, if I'm seeing that there's that natural curve of when you implement something that it takes people, I say roughly 6 months on the standard average to get used to a new software solution. Once you peek back past that 6 months, am I going to see that productivity increase? If it doesn't increase, again, what are my barriers here, et cetera? Christina, what about from your end? Have you done anything or different from that?
No, not really different, but I think just listening to you talk made me really just think that business case is very black and white, right? When we present it, it's in the numbers, it's what we're going to track. But what you really put out there is the human interaction, right? Like we can have all the best tools in the world, but if we're not adaptable by how people are embracing it, utilizing it, to your point on productivity, then that could be impacting our goals. But the simple answer, Luke, is we're measuring against our baseline of what we said, but then we're taking into account the impacts to that. And I think that's where Janine's feedback coming into the human impact of it that we have to look at and we have to evaluate and we have to pivot and be adaptable in that space.
Great, thanks, Christina. Moving on, and you both addressed this a little bit as well, but when a technology is not meeting expectations, what steps do you take to improve performance, and at what point do you cut your losses?
Yeah, so I'll go first, Janine, if that's okay. I think it's just kind of echoing what I just said, is if we're not meeting expectations, what's the impact? Is it the technology? Is it the human interaction? I've done implementations in the past where staff wanted to make it so much like their original process that they put in all these workarounds, right? Which really impacted our outcomes. So going back to communication and peers and all of that, of how important that is, it's so intertwined that one little thing can really impact. But I would say not cut your losses at 6 months, but at 6 months, if you're really struggling, you really need to be doing some sort of, I'm going to throw it back old school, SWOT analysis of really what is impacting and where you need to possibly pivot. Because sometimes it's not about walking away from it. It's about pivoting and utilizing it in a different way. That maybe you didn't even think about when you started your business case. So, Janine, I hope I gave you enough foundation to build off of and provide some clarity.
Yeah, I was actually going to flip the script a little bit on that one too, and just kind of speak of a personal experience that I had more recently. So typically as I look to implement new software or anything, I try my best to get the company to go at risk. So that gives us a little bit more leverage to understand if this isn't going to work and it's not working after a period of time, the onus is also on them. If I'm going to implement anything, I am looking at it to be a true partnership and that this company is looking to make sure that we are doing the best that we can and they're partnering with us and also helping identify areas of opportunity. So at one point, I had implemented an at-risk solution. Again, it was with the CDI team and my coding team. And to your point, Christina, right, after 6 months, we really weren't seeing the progress that we had expected to see, knowing that some of that is the patient mix, patient population that's coming in, but also like, hey, you looked at our data, you said we should be here. We're not even remotely close to that. What are our next steps? And then we moved into that, the SBAR, the SWOT analysis, the mitigation strategies. And then for us over here, that ultimately does get escalated up through our executive leadership team as well, because when you're investing in a software, whether it's at risk or not at risk, if there's a problem with the solution, whether it be the staff not getting on board with it or it just not being what we thought it was going to be, it still impacts the organization that our C-suite needs to be aware of. And so at that point, if the technology partner is not engaged, if they're not willing to help us identify it, or if we have spun our wheels numerous times and still aren't seeing it, that's where the benefit of being at risk allows us to cut our losses a little bit sooner. Sometimes you see, or at least I have seen in my career, the push for a 3-year, a 5-year contract. And when I do something new, especially if it's something new like AI solutions, I'm really, really being mindful of wanting to pilot that for a period of time.
Great, thank you, Janine. Moving on. You just mentioned, especially as like AI becomes more prominent. So this is a good question. What are the most practical and impactful applications for AI? How are you approaching vendor selection and management for these technologies, particularly regarding data security, integration, and calculating tangible ROI? And Janine, why don't, since you just ended on, kind of a with a little bit of a comment on AI, why don't we start with you?
Yeah, I think for me in the areas that I oversee, some of the most impactful applications for AI solution is really my denials support. So when I think about DRG downgrades, clinical medical necessity level of care denials, that is an opportunity where I see having chat, like a chat software, come in and take a look at not only the payer contract, but the clinical data and draft something together where somebody can audit and preview that. I also see it being impactful for coding. Again, clinical documentation for the low-hanging fruit of those query opportunities. And utilization review reports up through me in my VP position. And so making sure that they're reviewing those cases, at the ED, making sure we're getting those patients in that appropriate level of care. That is also something that this AI solution is impactful for me in my areas that I work in. Expanded beyond that, I think there's some billing that's definitely helpful with that, as well as authorization solutions to make sure we're getting that patient in the appropriate authorization. For selecting or approaching vendor selection at this point, because a lot of this is new and we are a union environment here in Western New York, we are heavily engaged with this with our C-suite. So meaning my boss, our EVP CFO, our EVP CIO are heavily engaged in assessing the software to make sure that it's meeting all these guidelines. And then we put it in additional barriers. Starting last year, we put in an AI review board that is led by our compliance team and has some IT folks on it as well. And we've enhanced our software solution when we put in new capital requests, that they go through all that data security, validating that our contracts, our payer contracts, all that good stuff is aligned with what's written in this contract. I will say, as we go down the AI solution, I do not envy my legal or data security IT team at all. They definitely have to be up to date and comparing a lot. But what about you, Christina? What have you seen from your end?
Well, I really think the hot topic right now is denials, right? Regardless whether it's on the front, middle, or back of the rev cycle. And I think that when we talk about payers, they've been in the AI space probably a little ahead of us as healthcare. And so I think we're just catching up. And I think that is the key, right? Is going to be continual. And I really think AI covers just about every area we can think in healthcare, right? Whether it be assist in the clinician or the documentation, to your point, with denials, that low-hanging fruit. But I also really think like customer service, right? Scheduling, things. I think in the next 10 years, I think that we're going to see that. I mean, we've seen models already where a patient calls in to schedule and it's a bot, right? Because the AI technology is so I can see us going there in 5 or 10 years, if not sooner. I think denials also on the back, post-claim adjudication is important, but I also really think looking at scoring and predictive analysis in utilization with AI. So from my perspective, being on the backside of it and finishing up all the claims and claim follow-up is, how do I take touches away and how do I focus on the claims that are going to bring me the most impact, in. So I think predictive analysis in AI is going to be huge too. But, right now the hot topic is denials, prior auths, autonomous coding. But I really do enjoy looking to see where we're going to go on some of those things in the back end that people probably are not as familiar with, that I think will take us a long ways in healthcare.
Christina, can I ask, Janine mentioned, at Kaleida they have an AI review board, a lot of input from the CIO and CFO in terms of AI investments. What is it like at UNC Health? Anything similar to that?
Yeah, as a system, we have an oversight, AI oversight, but just in RevCycle, we have an oversight group within RevCycle. So we're trying to make for sure that those things that involve IT, front, middle, clinical, physicians, all of that stakeholder group before it even gets to that higher level, because we already know what's there, so we don't want to waste people's time. So we have a mid, I guess, oversight group, for lack of a better term, and then that higher one for the whole system, which, when you think about having an academic and a health system together, there are going to be some different levels of that come through.
Very interesting. One other follow-up question I wanted to ask is, it sounds like both of you see a lot of practical use for AI in interactions with payers, and I'm hardly the first outside observer who has kind of seen this AI arms race developing between payers and providers. You say payers kind of got a head start, and then providers started doing this. Do you see this sort of, I'm going to keep calling it an arms race, even though that might be a little aggressive, but do you see this escalating or abating anytime soon? How do you see this sort of playing out, just based on your experience in the early days of AI?
Sure. So I'll start, and then Janine, if you want to follow up with anything I might missed. For me, I think AI on the healthcare side is going to drive our contracting, right? We're going to start utilizing this AI and make payers come to the table because we have more data, and data's power, right? We have more analytics, we understand it better. Why are you asking us for medical records on all these claims when ultimately you're paying 99% of them? That's things that I don't need to touch and that you're costing us. And then identifying where they're using robotics. And there's a lot of, things out there in legislation to try to not use robotics to make a clinical decision on the payer side, right? On that piece of it. And so I think healthcare systems having the AI on our side, that powers knowledge. And you kind of said the arms game. I put into AI the other day, give me a picture of Battle of the Bots, because we were having the same conversation somewhere else. And I figured that is it Rocket Socket? I don't know how old people that are listening in, but the old Rocket Socket game, that's really what came to mind when I think Battle of the Bots. It really is going to be us using data from a data analysis to try to make for sure that we are maximizing what we can, because we are on such short financial risk there. So Janine, anything to add?
No, I think you stole the words out of my mouth, Christina, especially when you think about the payer contracts and everything. That is the first thing that came to my mind. And exactly as you said, it is going to give us the data, so that at this point with what we do, I feel as though we're a little bit behind. We're at unfair or disadvantage, right? And so once we implement some of the software, exactly to your point, with the predictive analysis, even with that, to be able to have more robust conversations and say, this is not appropriate. We're starting to see this. We're overturning X, Y, and Z of these many cases. Let's agree to not deny this anymore and move on to something else. Yeah, I agree with everything you said.
Since we're on the topic of AI, I do want to ask one more question. Is there sort of, I would assume that there's a lot of hype that probably just is just hype, that there is in some instances just not much practical use. Do you think that you have to sort of resist the temptation to sort of chase these technologies because they're so new and cutting edge right now? Is that something that you see an appetite for among leadership in your systems or among staff, that you kind of need to temper the expectations for it?
I think. Oh, go ahead, Christina. Go ahead.
No, I was going to say, I think sometimes it's, I'm going to say the shiny new toy, right? So, folks are out there, they're looking, they're researching, they're on LinkedIn, they see articles come up, right? And everything sounds great. But I think, to our point about communication and stakeholders from earlier in the conversation, is making sure operationally it makes sense. And I do feel like, Luke, to your point, people are probably chasing, but I think it's people like Janine and I, and probably folks that are on the call, that have to say, let's take a step back, let's be strategic in it, let's make for sure it makes sense, and really analyze the impacts on the organization. Sorry, Janine.
No, I agree with that, because I also think that, there's innate fear when folks start talking about AI solution, but I don't know how many people on this call use chat, and as much as chat is great and helpful, there have been times that he has definitely taken some things that I said, and I'm like, no, I didn't say that, I said this, look up this, not that. So at the end of the day, it's not the golden ticket, the end-all be-all solution. We still need people to go in and audit and look at things. And to your point, Christina, that's the communication that I think that is crucial. I think we'll see a shift in what positions do, maybe. They're more audited, they're more double checking, they're more, validating everything that has come through. But I do think there is a little bit of that fear of if they're going to take our jobs over the next few years, when the reality is exactly like you said. It's not the end-all solution at this point. It's chat and other AI solutions definitely have a way to go. Yes.
Yeah, and I think I want to follow up to what Janine said, just because it feels like it comes up at a lot of conferences and small group discussions, is people thinking that their jobs are going to go away, and making sure, and I'm sure a lot of people that have joined our call have experienced this, but the importance is making for sure that our team members feel like we value their intellect and their abilities, and that is the reason why we want to take all the easy things away, right? Because we want to maximize and utilize what they're there for, and not to do the mundane task. And I think that's important, is making for sure that our team members, even mine and Janine and ourselves, making for sure that we feel like that we're empowered and that we are making a difference in it, and that is the purpose of moving forward with some of this AI technology.
Great stuff. Thank you both. I do want to remind the audience that you can submit questions. To submit a question, click on the Q&A widget. It may be open already and appear on the left side of your screen. We'd love to get some questions. And moving on to the next question. Looking ahead 3 to 4 years, what is one technology or trend that you believe will be the most transformative for the revenue cycle? And we just finished talking about AI for about 5 minutes, 10 minutes. So we may have covered that a little bit, but Christina, would you like to start?
Sure. I think we've probably talked about this and covered it, but just to bring it all together, I think predictive, conversational, that's the one I think I'm probably most excited about. If you would have asked me a few years ago, denials, AI would have been probably what I was most excited about. But I think now, looking to the future, I think it's that conversational AI that I think will help change the game for us as we go. And self-correcting workflows, right? As AI advances and correcting itself, I think that, that's great, but it brings on a whole other trust issues and to Janine's point, QAing and making for sure. But those are things that really excite me when we talk about the future of technology and what can be there. Janine?
I agree. I think we hit all this point. I think that, what we're talking about today, we don't know what's going to be created in 3 to 4 years now. So, we could have our predictive analysis implemented in 2 years, and then next year, the year after that, we'll hear about something completely different that we're going to be like, oh, look, this is the new frontier of everything that we can do, because technology is just evolving at such a fast rate right now. And to the point of, we don't want to necessarily chase everything that's out there. There is a benefit to letting other people trial some of it first, to, let them get some of the kinks out before you implement it. But there is also some of that, that new toy, golden ticket, like, ooh, I want the shiny new toy. That's what you said, the shiny new toy. Implement it and use it, because it's gonna get me everything. But I agree. I think that I just really think that with technology evolving the way that it has, that we're not even talking about what could be happening in the next 3 to 4 years.
Interesting. I think you mentioned this too earlier, Janine, that there's sort of like so much uncertainty around regulation in healthcare in general, kind of with a lot of financial hurdles that probably make it difficult, I would assume, to kind of see or to predict how the future will play out in terms of what technology will be important. Would you agree with that?
Yeah, I do. I think that it's only, again, with regulations changing, policies changing, payer tactics changing, I think that you need to be thoughtful in what you're looking at implementing and really measuring, as much as that employee satisfaction, patient satisfaction, clinician satisfaction is super important. I'm not trying to demean any of that. I think, you have to take a good look at what is really my return on this. Am I going to be getting all that back in? Am I going to be able to have those robust conversations with the payer? Am I going to be able to decrease my denials or decrease my timely write-offs or anything like that? To me, I think that is going to be something that's going to have to be looked at before implementation and during implementation of an AI solution. Christina, what are your thoughts?
No, I totally agree. One of the things I don't think that we touched on in talking about AI, but you kind of hit a thought with me in just now, is the cost, right? It's great to automate. It's great to have the AI. It is great to do all the things. But if I didn't get a positive ROI, and I guess we did touch on ROI a little bit, but I will give a personal example from a previous organization is they were so our IT gentlemen were wanting so much to push how many projects that they could get through in automation and AI that there were things on the list that I may have only been using half an FTE for, but the cost to maintain that AI and bot combo was going to cost more than a half FTE was. So I think we just have to be careful too in healthcare as we're looking at that is what's the benefit and is it worth it? We don't want to use AI just to say that we're using AI. We want to be strategic with it. We want to be purposeful and intentional with what we're doing.
Yeah, that's a great point. Great point with the staff in comparison.
Yeah, really good stuff. Thank you both. Christina, let's start with you. But from today's discussion, what is one or two takeaways for the audience to lead with?
I think the biggest takeaway is, making for sure you have the right stakeholders. As you could tell, I think throughout my thing is communication, right? And making for sure that we have brought everyone to the table that needs to be there, all the way from the end user to IT, to compliance, to legal, whoever needs to be at the table, that we bring them at the right time. So that is probably the biggest takeaway, and making for sure that we are analyzing the impacts, and the ROI is not just always money. It could be satisfaction, whether it's clinician or staff. And those are the big two takeaways, is making for sure that you're just mindful of those things for me.
Thank you.
I agree. Yeah, I agree. I don't have anything to add to that. Those would be my two takeaways too. I mean, I think, it's important as leaders to recognize that when you're implementing new things, it can instill fear in people. Some folks just really don't like change. So having that empathy and working with your teams to make sure that there's a successful implementation is crucial. And again, the metrics. Christina, you said it earlier, data is everything, and our data really is everything, not only to the external, but internally as well, to understand how we're performing.
Wonderful. Thank you both very much. Our audience has been a little bit quiet today, so I think we'll end here. In closing, please note that our next Winning Edge program on September 16th will cover the winning edge for handling the APP boom. A live clickable link will appear at the close of this program, taking you to our registration page for the event. Remember to follow along all week for continued coverage on technology investment by visiting our website, healthleadersmedia.com. I want to thank our panelists, Christina, Janine, thank you very much for an excellent discussion. And finally, thank you to you and our audience for participating. We hope you enjoyed today's program and look forward to seeing you during our next Winning Edge program on handling the APP boom. Thank you.